vaccine, or did you lie on all those podcasts? We have all of this on tape, by the way.
Yeah, Senator, as you know, because it's been repeatedly debunked, that statement that I made on the Lex Free podcast was a fragment of the statement. He asked me, and anybody who actually goes and looks at that podcast will see this. He asked me, are there vaccines that are safe and effective? And I said to him, some of the live virus vaccines are. And I said, there are no vaccines that are safe and effective. And I was going to continue for every person. Every medicine has people who are sensitive to them, including vaccines.
Right.
So he interrupted me at that point. I've corrected it many times, including on national TV. You know about this, Senator Wyden. So bringing this up right now is dishonest.
Let's be clear about what you've actually done then, since you want to deny your statement.
Why do they get to talk about vaccines, but when Rico does it, all my pages are nuked, and I can't go live for almost 300 days on the Club Rico podcast? I had to start safe and effective in 2 other pages. They can talk about it openly, though.
Vaccine, but to prevent any future access to the life-saving vaccine. Are you denying that? Your name is on the petition.
There's no such thing as a life-saving.
CDC recommended the COVID vaccine without any scientific basis for 6-year-old children. Most experts agree today, even the people who did it back then, that COVID vaccines are inappropriate for 6-year-old children who basically have a 0 risk from COVID. That's why I brought that lawsuit. I don't want to. I want to emphasize
the facts.
Prayers have been answered. RFK Jr. will be confirmed as the head of Health and Human Services for the United States of America. Do you know what that means? If you don't, I will tell you and I will show you. But let's just get through this.
Of what happened in Samoa is absolutely wrong, and you know it's wrong.
We'll get to that in a moment. Right now, we're talking about the petition that you filed to block Americans from having access to the vaccine and to prevent any future access to the vaccine. Those facts are on the record.
Well, it wasn't made for everybody. I know who it was made for, and I have the proof. That's why my page keeps getting taken down.
Young science. In 2021, in a book called The Measles Book, you wrote that parents had been, quote, misled into believing that measles is a deadly disease and that measles vaccines are necessary, safe, and effective. The reality is measles are, in fact,
you see our namesake keeps coming up. It was a good name, Safe and Effective Podcast.
Contributed to the deaths of 83 people, most of them children, in a measles outbreak in Samoa. So my question here is, Mr. Kennedy, is measles deadly, yes or no?
The death rate from measles historically in this country in 1963, the year before the introduction of the vaccine, was 1 in 10,000. Let me explain what happened in Samoa. In Samoa in 2017 or 2015,
it was a measles vaccine induced outbreak.
And the vaccination rates in Samoa dropped precipitously from about 63% to the mid-30s, so they've never been very high. In 2018, 2 more kids died following the MMR vaccine, and the government of Samoa banned the MMR vaccine. I arrived a year later when vaccination rates were already below any previous level. I went there, nothing with vaccines. I went there to introduce a medical informatics system that would digitalize records in Samoa and make health delivery much more efficient. I never gave any public statement about vaccines. You cannot find a single Samoan who will say, I didn't get a vaccine because of Bobby Kennedy. I went in June of 2019. The measles outbreak started in August. Oh, clearly I have nothing to do with the measles. Not only that,
Mr. Kennedy,
Senator,
my
not only that, if you
time-
let me finish, Senator,
That's the time.
if you let me finish, Senator, if you let me finish, there are 83 people died when the tissue samples were sent to New Zealand. Most of those people did not have measles. We don't know what was killing them. The same outbreak occurred in Tonga and Fiji, and no extra people died. There were 7 measles outbreaks in the 13 years prior.
I would like to get my time back. The nominee wrote a book saying that people have been misled into believing that measles is a deadly disease. He's trying now to play down his role in Samoa. That's not what the parents say. That's not what Governor Green says. It's time to make sure that we blow the whistle on actually what your views are. At least we're starting.
We need to move on. I support the measles vaccine. I support the polio vaccine. I will do nothing as HHS secretary that makes it difficult or discourages people from taking it.
Anybody who believes that ought to look at the measles book you wrote saying parents have been misled into believing that measles is a deadly disease. That's not true.
We need to move on. Senator Grassley.
Welcome. I'm going to do like I did in my office. I'm just going to make some points to you. I got about 7 I want to quickly get done. And then at the end, I'm going to ask if you disagree with anything I say and then address those things you disagree with. I'll make sure I say for you to do that. A key responsibility of each member of Congress is oversight. Oversight allows us to hold bureaucrats accountable to the rule of law, and it helps keep faith with taxpayers. I expect HHS to provide timely and complete responses to congressional oversight. Number 2, PBMs, something you and I discussed in our office. I've been working to hold pharmacy benefit managers accountable in order to lower prescription drug prices. I expect you to work with us to hold PBMs accountable, and that may even asking your support for legislation that's before the Congress. But drug pricing, Senator Durbin and I have for a while been trying to get a bill passed that requires price disclosures on TV ads for prescription drugs. Knowing what something costs before buying it is just common sense. President Trump tried to do this by regulation in his first term. Vice President
Ads for prescription medicine, where you
his feet and opening up. It also ignored concerns from rural farmers.
he wasn't supposed to make it to this position, and I'll show you why. This the one is a lot, but yeah, this is this. Because this is going to bring transparency.
Residency slots. I expect you to prioritize rural Americans' healthcare needs. On agriculture, in our meeting earlier this month, we talked at length about agriculture. You prefaced the conversation by saying you will not have jurisdiction over these issues. I expect you to leave agricultural practice regulations to the proper agencies, and for the most part, USDA and EPA.
You failed us. You don't get to make demands. You just shut the hell up and finish reading your hearing so we can ignore you.
Yes, requesting that they provide information regarding conflicts of interest on the Dietary Guideline Advisory Committee to increase transparency. I expect you to provide Congress with confidential financial disclosures from the advisory committee before finalizing dietary guidelines, so we know that nobody has a vested interest in it, is having undue influence.
Wait, you want us to request permission from the people who the FDA legalized poisoning our food and said it was FDA approved. Now you want us to go back to them for no, ignoring and dissolving if we can.
24 contractors and grantees whose job it is to place unaccompanied children with sponsors. In many cases, children have been placed with improper vetted sponsors, placing them at risk of trafficking. The Biden administration's HHS directed these taxpayer-funded contractors and grantees to not respond to my inquiry.
So they're admitting that the Biden administration trafficked children.
Expect you to produce to me the
amazing
records and data I've requested and instruct HHS contractors to fully cooperate with my investigation. I also expect HHS to not retaliate against any whistleblowers, including those who identify ORR's failures in vetting sponsors of unaccompanied. You got 45 seconds to respond.
Vance Kennedy 2028. I'll be one of the first to say it.
Approach to administration agents will be radical transparency. If members of this committee or other members of Congress want information, the doors are open. I've spent many years litigating against NIH and its sub-agencies. HHS and its sub-agencies, NIH, CDC, FDA, on FOIA issues, trying to get information that we, the taxpayers, paid for, and oftentimes getting back redacted copies after a year or 2 years of litigation. That should not be the case. And if Congress asks me for information, you will get it immediately.
Thank you.
Thank you. Senator Cantwell is next, but until she returns, I will move on to down the list, and that would be Senator Cornyn.
Mr. Kennedy, welcome to you.
You know, all these people served us up to the World Economic Forum and the World Health Organization 4 years ago. I don't want to hear about any of these people. But what I will remind you is why we needed Robert F. Kennedy Jr. and what he's done for this country. Do you guys remember, who remembers when they kicked Trump off of social media? And remember right before that, they had kicked Alex Jones off of all internet platforms, Meta, Facebook, Instagram, Twitter at the time. A lot of people don't know this, but they did the same thing to RFK Jr. and a man who was a hero by the name of Dale Bigtree. What Dale Bigtree and Robert F. Kennedy Jr. did was they filed a lawsuit against the pharmaceutical companies, and they won, the largest in history. And the premise was they brought the pharmaceutical companies to court. They made their claims. A judge said that if the pharmaceutical company, because what they claimed was that out of 135 different vaccines on the childhood vaccine schedule, now you got to also ask questions. 135, well, which ones did your kids get? Why are different kids in different regions and different hospitals receiving different injections? They're not all getting 135. So why are they putting certain ones for certain people? You know, it's the same thing with the CV. I want to see the map. I want to know how they divided up territory. What demographics and what areas got which ones and why? How do they know who gets what? There's 135 of them. Okay. What they had to prove, what the vaccine companies had, the manufacturers had to prove, was that they ever safety tested. The judge lowered the threshold of to throw out the case. He said, all you have to do is show me that you've safety tested at least one. Just one. That was it. And when they could not show that in 35 years, they have never safety tested not even one childhood vaccine, they won this massive case. And Robert F. Kennedy made certain claims about this case that were very controversial at the time, that they wanted to sweep under the rug, that they're not going to be able to do anymore because he is now the head of Health and Human Services for the United States. We can go back over this case shortly, but he won it with Dale Bigtree, which was huge. And no one ever talks about it because of one thing that he said. And I'm going to tell you what he said. I know this might get me kicked off of YouTube, and it shouldn't, because we're just going over what the American Health and Human Services director, secretary, the head of it, is literally saying. We're just going over his words. All vaccines are safe and effective. They work amazing. I love vaccines. I take about 3 a day. I take when I wake up. I pop one before I eat lunch. Everyone loves them. Okay, so vaccines are safe and effective. Let's just go over the cases and go over what Kennedy says. But let's go back to the hearing, see if there's anything interesting being said.
And it's momentary. And we have that opportunity to save their lives. And then if we miss that little short window, they're off to the races again.
I appreciate your answer. Our time is short. Let me get to one more question that I think is very important. Under the first Trump administration, the number of people receiving HIV treatment in Africa through the President's Emergency Plan for AIDS Relief, otherwise known as PEPFAR, it increased, this is during the first Trump administration, from 13 million people to 18 million people across 50 countries, primarily in Africa.
They're doing all this in Africa for a reason. It's because they have to perfect what they're going to use against the demographic here in America that they're trying to wipe. And we know who that. You know who we're talking about.
Reported that 2.8 million babies were born without HIV. That was something that would not have happened but for the PEPFAR program. So it has simply been one of the most successful public health programs in the world and saved approximately 26 million lives. Failure to continue this program, in my view, would risk ceding that leadership to adversaries like China. And I'd like to know whether you support the objectives and goals of PEPFAR, and would you work with me and my colleagues to make sure that this program continues to provide life-saving antiviral drugs to people who are most in need?
No,
I absolutely support PEPFAR.
You shouldn't.
And I will happily work with you to strengthen the program.
Why are we making decisions for countries in Africa? Why can't we just focus on our country, the United States, America? America first, America only. We should not be talking about distribution of other medications in other countries. Why are we doing? That's none of our business. These are sovereign nations that have their own governments and their own health secretaries. We should not be deciding for them.
Mr. Kennedy, to one of the most important healthcare jobs in America. And the reason I think it's so important is for many of the reasons you said in your opening statement, which is that we live in the richest country in the world, and we have some of the worst health outcomes of any industrialized country.
Absolutely.
We live in the richest country in the world, and we have some of the lowest life expectancy rates of anybody in the industrialized world.
Which doesn't make sense if we have a EPA and an FDA that are effective. If we have a CDC that's worth its weight in salt, then that should not be the case. So obviously we don't.
40% of them are going to suffer adult diabetes as a result of their diet. These are, and we're, as I said, spending more than any other country in the world, and our families, every single person's constituents in this Senate are facing chronic shortages when it comes to healthcare. My friend from Texas, Senator Cornyn, has been a champion on mental health care. We have an epidemic, as he knows, across this country in mental health care, partly because of what the massive social media platforms that were sitting behind the President of the United States have inflicted on our children for their profit in the last decade or so. So we have no shortage of challenges to confront, and I even agree with some of the diagnosis of Mr. Kennedy. What is so disturbing to me is that out of 330 million Americans, we're being asked to put somebody in this job who has spent 50 years of his life not honoring the tradition that he talked about at the beginning of this conversation, but peddling in half-truths. peddling in false statements, peddling in theories that, create doubt about whether or not things that we know are safe are unsafe. Not that
We don't know a goddamn thing at all. Kennedy actually did the research. You're just repeating what some other asshole read to you. It's a big difference.
in school districts all in this country would be better off not getting vaccinated than getting vaccinated. Unlike his own children who were vaccinated, unlike the people he invited to his house in Los Angeles for their party who were vaccinated. For everybody else, it's about peddling these half-truths.
No, the truth is, it's not one size fit all. Yes, it will run through his body and his children because of his genetics. But there are other people who this thing that's in those has an effect on. It causes swelling. There's a lot of different things that they do to bodies, but it's based on your genetic background, which we can associate according to this to the medical records with testosterone levels. And that's how you can separate different humans. And that's how you know whatever's in these injections is going to react based on testosterone levels.
I didn't say it was deliberately targeted. I just quoted an NIH-funded and NIH published study.
Did you say that it targets black and white people but spared Ashkenazi?
I quoted a study, Your Honor. I quoted an NIH study that showed
I'll take that as
certain
yes.
race.
And they don't want him to talk.
Did you say that Lyme disease
And this is what we're going to talk about.
Is highly likely a materially engineered bioweapon? I made sure I put in the highly likely. Did you say Lyme disease is a highly likely militarily engineered bioweapon?
It's not natural.
I probably did say that.
Did you say that? I want all of our colleagues to hear it, Mr. Kennedy. I wanted to hear it. You said yes. Did you say that exposure to pesticides causes children to become transgender?
No, I never said that.
I said it.
I have the record that I'll give to the chairman, and he can make his judgment about what you said.
I said it.
Did you write in your book, and it's undeniable, that African AIDS is an entirely different disease from Western AIDS? Yes or no, Mr. Kennedy?
I'm not sure if I made that.
I'll give it to the chairman, Mr. Kennedy. And my final question, did you say on a podcast, and I quote, I wouldn't leave abortion to the states. My belief is we should leave it to the woman. We shouldn't have the government involved, even if it's full term. Did you say that, Mr. Kennedy?
Senator, I believe that every abortion is a tragedy.
Did you say it, Mr. Kennedy?
This
matters. It doesn't matter what you come here and say that isn't true, that's not reflective of what you really believe, that you haven't said over decade after decade after decade, because unlike other jobs we're confirming around this place, this is a job where it is life and death for the kids that I used to work for in the Denver public schools. And for
Did you see who the last head of HHS was? And where was this tough talk? And where was this lame idiot when it came time to affirm that person 4 years ago? And what good did it do? Now you want to be hard on Kennedy? We're not buying it.
Say to the president, I have no influence over him. I hope my colleagues will say to the president, out of 330 million Americans, we can do better than this.
Thank you. We need to move on. Senator Cassidy.
Get the hell out of here.
Mr. Kennedy, President Trump has sworn to protect Medicare. Republicans are exploring reforms to Medicaid that could help pay for Trump administration priorities. With this context, what will you do with dual eligibles?
About,
Dual eligibles.
well, dual eligibles are not right now served very well under the system. Those are people who are eligible for both.
Yeah, he does sound drunk, that last guy.
Um,
Definitely needs to go to an AA meeting before showing up to
I suppose
a confirmation hearing.
to make sure that the
Weasel.
programs are consolidated, that they're integrated, and the care is integrated. I look forward to working with you, Dr. Cassidy, on making sure that we take good care of people who are dual
And
eligible.
how would we how do you propose that we integrate those programs? Does Medicare pay more, Medicare pay less, Medicaid pay more, Medicaid pay less? How do we do that?
Well, I'm not exactly sure because I'm not in there. I mean, it is difficult to integrate them because Medicare is under fee for service. It's paid for by employer taxes. Medicaid is fully paid for by the federal government, and it's not fee for service. So
He's not he's not the accountant. Why would he know this?
I look forward to exploring options with you.
Republicans, again, are looking at ways to potentially reform Medicaid to help, pay for President Trump's priorities, but to improve outcomes. What thoughts do you have regarding Medicaid reform?
Well, Medicaid is not working for Americans, and it's specifically not working for the target population. Most Americans, like myself, I'm on Medicare Advantage. I'm very happy with it. Most people who are on Medicaid are not happy. The premiums are too high. The deductibles are too high. The networks are narrow. The best doctors will not accept it. The best hospitals. And particularly, Medicaid was only designed for a target population, the poorest Americans. It's now been dramatically expanded. And the irony of the expansion is that the poorest Americans are now being robbed. Their services have dramatically decreased, even though we've increased the price of Medicare by 60% over the last 4 years. The target population is being robbed.
With that said,
other options.
Obviously, you thought about that, and I appreciate that. What reforms do you recommend, again, that would improve services, I suppose, but also make it more cost efficient?
Well, President Trump has given me the charge of improving quality of care and lowering the price of care for all Americans. There are many things that we can do. What we want to, the ultimate outcome, I think, is to increase transparency, to increase accountability, and to transition to a value-based system rather than a fee-based system.
So
rather than a service-based
on
system.
Medicaid in particular, can you just kind of take those kind of general principles and apply it to the Medicaid program?
I think that there are many options with telemedicine, with AI right now, and there's including direct primary care systems. We're seeing that movement grow across the country. There's one of the largest.
So going back to Medicaid though, and speaking of these specific advances, what reforms are you proposing with these ideas vis-a-vis Medicaid?
Well, I don't have a broad proposal for dismantling the program.
Of course not saying that.
I think what we need to do is we need to experiment with pilot programs in each state. We need to keep our eye on the ultimate goal, which is value-based care, which is transparency, accountability, access.
And one more thing, going back to Medicare, you mentioned you're an MA. You mentioned earlier the Medicare fee for service. Do you have any kind of thoughts as to whether or not patients on fee for service should move into MA, or how should we handle that?
Whether patients
who are on Medicare fee for service.
Traditional Medicare,
Yes.
that's their choice right now. I think 32 million Americans, or 30 million Americans on Medicare, on traditional Medicare, and then another 34 on Medicare Advantage, roughly half and half. And I think more people would rather be on Medicare Advantage because it offers very good services. But people can't afford it. It's much more expensive. In answer to your first question, there are all kinds of exciting things that we can be doing, including cooperatives, which President Trump has supported, including health savings accounts, which President Trump has supported. But all of these things to make people more accountable for their own health.
And so we'd bring the cooperatives and the health savings accounts into Medicare and Medicaid?
Exactly. We try to increase those, the use of those and to direct primary care to continue to transition to,
Look, just confirm. He's going to be confirmed. I don't know why we're sitting here listening to these idiots question him while also cutting him off and not giving him a chance to respond. But let's go back to what I was talking about a minute ago. RFK Jr. wins case against government for vaccine safety violations. Robert F. Kennedy Jr. teamed up with Dale Bigtree of the Informed Consent Action Network, which is ICANN, to take the Department of Health and Human Services for vaccine safety violations, and they have won. Their lawsuit was brought forth evidence that vaccine safety has been neglected for over 30 years, and as we know it, it's been a sham, showing that the government agencies that we are to trust are not doing their jobs to ensure the improved safety of immunizations. With no safety testing, we don't know what they are. No safety testing is we don't know what they do. We don't know the differences between humans. All humans are not the same. What might make me sick might not make you sick. What might make someone else who looks like me sick, but they're from a different part of the world with a different genetic background, might not make me sick. It's different. It's going to have a different effect on people. That's something that we've known for a long time. When this came out, Robert F. Kennedy was in a celebration and he was making a video, but he said this right here. And this is what they keep bringing up. Now, you had to go all the way to the BBC in Europe to read this. RFK Jr.'s claims, I can't say this word, widely criticized. A vocal critic of the restrictions to the limit of the spread of the COOF, Kennedy said at a press conference event in a video that the New York Post had posted that the COOF is targeted to attack Caucasians and Black people. The people who are most immune are the Ashkenazi Jews and the Chinese. The differences between those two groups are basically the spectrum for humans on Earth. Americans, as far as Caucasian and Blacks, are on one end of the spectrum, Jews and Chinese people on the other. The differences between the two are testosterone levels, natural in nature. If you stripped the skin off of humans, males, and you put them on this spectrum, the Caucasian and Black Americans would be on one side, Jews and Chinese people would be on the other. If what was inside of these and the COOF injections was testosterone reactive, it would be there, they would be immune to the effects of it, but it would cause dramatic effects in our physiology, causing cardiac arrest in a lot of cases in Americans or Caucasians and Black people. Who are the people that you're seeing that are dying from the response to the COOF? Now, there's only so much I can say on YouTube without, I don't know, I can't really talk, but again, they're all safe and effective. The name of this podcast, Safe and Effective. We do promote vaccines. However, if you come to Rumble, if you come to X, I will explain to you the differences and I'll give you the evidence and we can talk about it. I keep score. I've been keeping track of this for years now. I'm actually one of the top researchers on the topic and can tell you everything about it. The problem is I'm just limited on what I can tell you on certain platforms. I want to keep this YouTube page, so I'm not able to talk about it too much. I'm not going to talk about it too much on here, but on Rumble, I will go fucking insane. And on X, I will also go crazy. Let's see if they have anything better going on now.
appointees that are changed during every. So if you got rid of those two political appointees, you're not going to replace them with your political appointees. Well, President Biden this year changed 3,000 employees at HHS. 3,750.
So, 2,200, what departments are you going to pick them from?
Well, the same as President Biden did when he
Exactly.
3,000 out.
Minute 30, the chairman's been generous with colleagues on both sides and may have to go a couple minutes over. But let me just say, so let's just answer, this would be, I hope, since you're asking to become the top healthcare official in the United States and from the HHS, huge ramifications. And part of this job is to be the senior advisor to the president on health issues. So when we're looking at this purge and we're looking at laying off workers, when we're looking at potentially the president's illegal offer to try to buy out federal employees, which I would say to any federal employees, think twice.
If it was illegal, the president wouldn't do it, and it would not be allowed. This guy's full of it.
But if you are in this,
But he's a
position,
Democrat, so what do you
will you
expect?
pledge that you will not fire federal employees who work on food safety, work on trying to preventing things like salmonella?
They've done a horrible job.
I was an employee.
So that's a simple yes. I'm going to take that as a no. That's I take that as a no. Will you actually? We talked about protecting Americans from cyber criminals. Something we need to do a lot more on. Will you commit not to fire anyone in the health arena who currently works on protecting Americans from cyber attacks in their healthcare files?
I will commit to not firing anybody who's doing their job.
Based on your opinion, based upon your opinion, or your political agenda, or Mr. Trump's political?
That's why he's the head.
My opinion.
That's why he's the head. It's his opinion.
Any type of views on vaccines will be out of work. Will you freeze
As they
funding
should.
for community health centers? Will you freeze federal funds for community health centers the way the current administration is?
The White House has made clear that no funds are going to be denied to any American for benefits in any program.
Do you know what happens at community health centers? Those are direct.
Are you talking about the Indian health centers?
No, I'm talking about community health centers across the country.
I understand that. I mean, I strongly
So you're going to excuse Indian health centers, which is good, but others are not. They're going to get their funds frozen.
I strongly support community health centers, as does the president.
Does that mean you're not going to freeze the funding that is currently frozen?
The White House
He can't freeze if it's frozen. And
And
that's not frozen.
Sir, the direct payments are different than how the government operates. We fund the federal government down to community health centers. As a former governor, there's lots and lots of state programs that are related to healthcare.
This is a pathetic senator. He has no idea what he's talking about.
Then it goes to local programs. All of those don't
Just virtue
directly pay
signaling.
out $1 at a time, but they come from federal funding. They are all, even though they keep changing the guidance on a minute-by-minute basis, come from federal funding. They are all, even though they keep changing the guidance on a minute-by-minute basis, based upon 9:45 or 10:30 or 10:45, whatever time it is today, those funds are still frozen. Sir, I just honestly, I want to give you a fair shot.
What's that got to do with him? That's go yell at Trump. Go get mad at Trump. Go pick a fight with Trump. Leave Kennedy out of this.
Your willingness not to commit, try to recommend to the president to make sure these funds are unfrozen and that people's lives are at stake is a very disappointing answer.
Nobody's lives are at stake. Just a grift, money grab.
Chairman, thank you. Mr. Kennedy, it's good to see you again. We had some great visits in my office. We've done some follow-up calls to be able to go through. You and I have talked about 100 different issues and backgrounds, things. You've been able to address a lot of them today and just different questions to be able to clear up social media rumors and the things that are out there. And so I do appreciate that. We've talked about pharmacy benefit managers. We've talked about the nursing home rule the Biden administration put down. We talked about views on agriculture and commercial and row crop agriculture. We've talked about food issues, and you made it very, very clear. You're not going to tell Americans what to eat, but you do want Americans to know what they're eating. And I think that's a pretty fair perspective on that. I do want to talk to you about some areas that you and I have talked about as well. We have some disagreements, you and I, on the issue of life and when life begins on that. You've been very outspoken on that, and we've had some good opportunities to be able to talk about that. Title 10 is specifically in the HHS area. This is an area that has been interpreted for a long time, and President Trump in the first administration interpreted that rule to say that his administration will prohibit the performance, referral for, or promotion of abortion as a part of the Title 10 program. That he made that very clear in the first administration. Obviously, that's his decision to make again on that, on how he wants to handle that. He's made a lot of public statements on that. The Biden administration not only reversed that, not only rescinded that rule, but they went one step the other direction. In my state in Oklahoma, as you and I have talked about, the Biden administration cut off funding to the state of Oklahoma for AIDS testing for breast cancer screening and for other areas of poverty healthcare because my state didn't promote abortion. It wouldn't provide. If my state wouldn't promote abortion in the state, we got cut off for federal funds for AIDS testing and for other things. My simple question to you is, how are you going to handle Title 10 on that? I saw how President Biden handled that in the punitive measures that came on my state for those that are in rural healthcare. How are you going to handle Title 10?
I'm going to support President Trump's policies on Title 10. I agree with President Trump that every abortion is a tragedy. I agree with him that we cannot be a moral nation if we have 1.2 million abortions a year.
Absolutely. We cannot.
I agree with him that the states should control abortion. President Trump has told me that he wants to end late-term abortions, that he wants to protect conscious exceptions, and that he wants to end federal funding for abortions here or abroad. That's Title 10. I serve at the pleasure of the president. I'm going to implement his policies.
Thank you for that. President Biden, when he came in, immediately closed down the Office of Civil Rights and Conscience Protections within HHS. There's a statement that's come out recently that he's going to reopen that office again to be able to protect the civil rights of Americans. One of the things that Javier Becerra did immediately when he came into HHS was conscience protections for medical professionals that were being compelled against their conscience to perform medical procedures that violated their conscience. Javier Becerra stepped in immediately to HHS and withdrew that and said, no, the federal government will tell you what you believe about these issues. You don't have conscience protections anymore, and refuse to protect those folks. Will you step in and say that healthcare individuals have the right of conscience again, as the federal law allows?
Yeah, I mean, the first thing that occurs to me when you ask that question is, what patient would want somebody doing a surgery on them that believes that with the surgeries against their conscience being forced to perform that? I don't know anybody who would want to have a doctor performing a surgery that the doctor is morally opposed to. Listen, I came from a family that was split on life and choice. I have cousins today who believe that abortion at any stage is equivalent to homicide. Now, there are other people who believe the opposite. But the good thing in my family that
How is it not homicide?
That we were able to have those conversations and respect each other. And I wish that we could do that nationally. And if forcing somebody to participate in a medical procedure as a provider that they believe is murder does not make any sense to me. We need to welcome diversity in this country. We need to respect diversity. And we need to respect each other when we have different opinions and not force our opinions on other people.
Yeah, thank you for that. The FDA, under the Biden administration, changed the rules for the chemical abortion drug and said you no longer need to see a physician. So if you have an ectopic pregnancy or all kinds of other, don't even go anymore to see a physician. But they also changed an area that has been something that's been very particular. You've talked about a lot, and that's transparency. They changed the position and said, don't tell us if there's a side effect in this drug unless she dies. But other than that, don't tell us anymore. Literally, don't give transparent information to the American people or to the women who take this drug anymore. We don't want that reported. My question to you is, will FDA move to be able to actually give transparency to the American people and to say, this drug is no different than any other drug. We don't not going to protect it just because it's political for some folks. People should know side effects on this drug, and there should be reporting.
Yeah, I mean, it's against everything we believe in this country that patients or doctors should not be reporting adverse events. We need to know what adverse events are. We need to understand the safety of every drug, mifepristone and every other drug. And President Trump has made it clear to me that one of the things he is not taking a position yet on mifepristone, detailed position, but he's made it clear to me that he wants me to look at the safety issues, and I'll ask NIH, FDA to do that.
Thank you.
Senator Whitehouse.
Thank you, Chairman. Mr. Kennedy, I only have 5 minutes with you, so
and I've got a lot of experience with CMS. So you're just going to have to listen. And two things. One, if you want to move from advocacy to public responsibility, Americans are going to need to hear a clear and trustworthy recantation of what you have said on vaccinations, including a promise from you never to say vaccines aren't medically safe when they in fact are. Curative care together. Inhumane and stupid. Granny's home dying and can't get home care. If she can still get out into the yard or be driven to see the shore, to see Narragansett Beach, say, one more time, to recall childhood memories before she dies. Inhumane and stupid. Granny's home dying and the family's exhausted. And the respite care benefit is not to send a nurse or a caregiver, but to stuff Granny in an ambulance and haul her off to a hospital.
I'll be honest, I find these committee hearings to be boring and pointless. It's kind of like a humiliation ritual. In a way, it's like when I seen what they did to Pete Hegseth, and he still got confirmed anyway, but it was kind of like a bukkake of liberal nonsense just spewing on him, and he's like sitting there like, oh, he hasn't taken it. It was disgusting. It was embarrassing. And now they're doing the same thing. People who are unqualified, paid bureaucrats who just make their money and they show up and pretend that they're doing something. You know, when I look at it, I'm like, how do these people even get elected? I mean, it can't be that difficult. I don't know. I don't know why we don't just replace them with competent, patriotic people who are just not for sale. Why are we even wasting our time with these people? Another reason why they hate RFK and they did not want him here is because of this.
Concerned that Trump might be elected again. I think it's very likely. And if it
This is Yuval Noah Harari. He is the #2 in command of the World Economic Forum. He is the reason why they are pushing the gay and trans agenda. It's a top-down order. The World Economic Forum actually took over many Western nations' governments. They penetrated our cabinets, according to Klaus Schwab, and that's why everything's been upside down for the last few years. They fear Trump coming into office because they knew he would bring someone like RFK Jr. in. The vax agenda is from the World Economic Forum. The whole CV, Agenda 21, everything was top down with them. And they work in collaboration with the Bill and Melinda Gates Foundation. The World Health Organization is actually funded by the Bill and Melinda Gates Foundation for the United States. And there was one other big country that's contributing, but we've now pulled out. So they know that this is the end of all of their plans they've been working on for decades. And I mean, they didn't think this was going to happen, and we are lucky that it is. But listen to what he says.
you can stand that Trump might be elected again. I think it's very likely. And if it happens, it is likely to be the kind of like the death blow to what remains of the global order.
The global order is not around the entire planet. It's only for the Western world. Yuval Noah Harari is a gay man with a husband. So is Klaus Schwab. So is Emmanuel Macron. So is Barack Obama. So are all the leaders of these G7 countries that are a part of the Davos group. They've literally rewritten our societies in their own image. They're the reason why the chemicals are making your children gay. The television is telling your kids to be gay. Everything on the internet is promoting interracial couples and homosexuality, and especially with the community that they've been targeting with depopulation, the Black community. Now, to be Black is to be gay is the new slogan that the trans and these other communities, all orchestrated by the World Economic Forum, all are a part of this agenda to depopulate. Because I tell people the gay agenda is the depopulation agenda. Kids do not live to be very old. They self-delete before the age of 34, especially if they're trans or they have that mental dysmorphia. They don't last very long. It's not a long-term thing. And that's the world order that he says this will be the death blow to. That's what they're afraid of, because their plans were to drastically reduce the Earth's population, and then they would just oversee everything. Things fell apart when they didn't calculate sun exposure. Also, that would also change the timeline of the effects of the what they did to themselves in 2021. Also, they did not calculate fraud, fake passports. I don't know how they missed that one, but because of that, the world was saved. And now their agenda is lost because not enough people complied. Remember, they said everyone has to do it or it's not going to work. And because we have guns and free will, and we have men here that are willing to fist fight, they couldn't push it on us here. But to remember, it doesn't affect everybody the way it affects Caucasian men and Black men specifically. Remember, 94% of the people that are expiring from it are male. So it's testosterone reactive.
And he says it openly. Now, it should be clear that many of these politicians, they present a false dichotomy, a false binary vision of the world, as if you have to choose between patriotism and globalism.
You do.
Between being loyal to your...
I can't be a globalist and a nationalist. The two are diametrically opposed to one another. I cannot be a globalist and a patriot. There's no, they're the two they oppose one another. They're opposing magnets. There's no way you can be both. He should know better than being able to go both ways.
Nation and being loyal to some kind of, I don't know, global government or whatever. You can say
a global one world government. So who's going to be in charge? I don't want a non-American telling me what to do in my country because they're not going to understand my Constitution or what my forefathers fought for or what my forefathers built or the intended purposes of our culture and who we are here. There's, like I said, there's a big push for communism here, but it's just from kids who don't know any better. And it's not going to work. And that's why it's a good thing that all these deportations are happening, because a lot of those people are not here working in the fields. They're here living off the state. They're communists. And we have too many American communists who are screaming about, because they thought they were going to lose their food stamps. Maybe you should not be on those forever anyway. Maybe that's communism. My capitalist tax dollars are going to fund your utopia where you get free housing, free food, free education. So everything's just free, but I got to work. Nothing's free for me, but I provide an environment that's free for you. That's not equitable. That's not fair. We got to stop that too. So let's get back to this. Let's see if there's anything new here going on.
FDA's own prescribing label mentioned that 3 to 5% of women taking this drug end up in the emergency room. My question is, if confirmed as Secretary of HHS, will you commit to working with the FDA Commission and review the regulatory actions that are threatening the safety of women?
Sorry, Senator. As I said to Senator Langford, I think it's an immoral policy where patients are not allowed to report adverse events, or doctors are discouraged from doing that. President Trump has asked me to study the safety of mifepristone. He has not yet taken a stand on how to regulate it. Whatever he does, I will implement those policies, and I will work with this committee, make those policies make sense.
Thank you, Mr. Kennedy. Senator Hassan.
Thank you, Mr. Chair and Ranking Member Wyden, and welcome, Mr. Kennedy, and to your family as well. I want to start with a couple of concerns I have, just briefly on Medicaid. States share in the funding of Medicaid. Millions of disabled children in this country are alive because of Medicaid. Millions of people with addiction in this country are in recovery because of the services provided to them by Medicaid. And millions of chronically ill people who, until Medicaid expansion was enacted,
I'll be honest, there's no way to prove any of the stuff she's saying is true. There's no way to know, because we don't know what would have happened without it. So you don't know. You're just talking because you're being paid to. You're being paid by lobbyists and special interests, and that's where all your side money comes from. You do what you're told. So we can't trust these people. We can't. And that's why we're putting new people in place that we can trust. Patriots.
One of our greatest public health triumphs. And you don't need, I'm not talking about abstract medical science. One of the people who helped raise me was my grandfather, who was a pediatrician. He practiced medicine in this country from 1921 until the mid-1980s. And I heard details about the difference those vaccines made in saving lives in the children who were under his care. Vaccination has helped to eradicate many deadly diseases in the United States, including polio and smallpox, something we should be proud of as Americans. I am extremely concerned that as Secretary, you would be able to halt critical vaccine research and to exploit parents' natural worries by advising them not to vaccinate their children. This will lead to more children getting sick.
That's not true. That's not true. Now you're spreading disinformation.
American children died a year from measles. This is too much of a risk for our country, and there is no reason that any of us should believe that you have reversed the anti-vaccine views that you have promoted for 25 years.
So what did humans do before those were invented? Shut the heck up.
For example,
sorry, I don't mean to curse. It just makes me upset.
That the polio vaccine killed many, 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 many more people than polio ever did by causing fatal cancers, while rigorous safety studies show that to be completely false. Now, let's go to something we agree upon. I am really heartened to see that one area where we agree on is on women's reproductive freedom. In your own words, it's not the government's place to tell people what to do with their bodies. You said that, correct? Mr. Kennedy, in 2023, you came to New Hampshire and said, quote, I'm pro-choice. I don't think the government has any business telling people what they can or cannot do with their body. So you said that, right?
Yes.
Yep. But you also said we need to trust the women to make that choice because I don't trust government to make any choices. You said that too, right?
Yes.
It is remarkable that you have such a long record of fighting for women's reproductive freedom, and really great that my Republican colleagues are so open to voting for a pro-choice HHS secretary. So, Mr. Kennedy, I'm confused. You have clearly stated in the past that bodily autonomy is one of your core values. The question is, do you stand for that value or not? When was it that you decided to sell out the values you've had your whole life in order to be given power by President Trump?
Well, let's see here. He's injured and he's done the research and he's won cases against these companies that manufacture these injections that have all of a sudden started making people's hearts not work anymore. I have to be careful about how I talk on YouTube. Remember, on Rumble and on X, I will tell you everything you need to know about this topic. I will teach you everything and I will explain it with proof and evidence. And then you'll understand what I'm trying to say. And I'm trying to dance around, but just know for one thing's for sure. This confirmation hearing of Robert F. Kennedy Jr. becoming our HHS secretary is one of the most important things in our nation's history, actually in human history. And I will explain why, since there was a huge agenda to wipe out the Western world, well, a particular part of the Western world, a particular group, a particular demographic, a very specific demographic.
Orders
the BLM demographic. I'll just say that.
Direly needed health care, you'll follow his order. If Mr. Trump, as he did yesterday, orders a halt on Medicaid payments that are essential for taking care of people with disabilities all around this country, you're going to follow that order because you are willing.
So what we're supposed
to sacrifice
so what do we
values, your knowledge. If President Trump tells you.
So what's the plan? We take care of everybody forever for the rest of their lives? We just let people live off the government forever? That sounds like Cuba. That sounds like my home country. And where are we at right now in the world? No, we can't do that.
That policy will not deprive any American.
Yeah, the problem is the White House issued that statement only after we pointed out the damage it would do, and it became politically uncomfortable for them. You know what else that freeze on federal funding did? It halted funds for critical research that could cure pediatric cancer. So if the president tells you to do that, you're going to stop that too. That's enough.
Senator Cortez Masto is next.
Thank you. Mr. Kennedy, thank you for coming into my office and having the conversation that we did. I appreciate your passion and your belief, and you've spent years really talking about the issues that matter to you, and I appreciate that. Let me ask you a couple of questions, though I just need some clarification. Right now, there's a 40-year-old law that requires hospital ERs accepting payment from Medicare to actually provide emergency care to patients. So let's say a woman experiencing a life-threatening condition like a heart attack goes to the ER. As a lawyer, you would agree that that federal law protects her right to emergency care, correct?
Yes.
So now a pregnant woman with life-threatening bleeding from an incomplete miscarriage goes to the ER. Let me rephrase that so you can hear. A pregnant woman with a life-threatening bleeding from an incomplete miscarriage goes to the ER, and her doctor also determines that she needs an emergency abortion. But she's in a state where abortion is banned. You would agree also as an attorney that federal law protects her.
It's a nonsensical hypothetical, since it's the odds of that even happening are so remarkably low that it's not even, it's just a nonsensical hypothetical.
Law preempts state law?
The federal constitution does. Sometimes not every federal law preempts state laws. It could be unconstitutional. I'm not trying to
this case, let me
Senator,
answer
I'm
this.
just telling you, I don't know the
I
answer to
appreciate
that
that.
question.
But what authority do you have over this as the director of HHS
What authority do I have?
to enforce the law?
In what regards?
Yeah, like what are you talking
To
about?
make sure that a hospital that receives payment from Medicare is ensuring that they're providing the necessary emergency care to patients when they present. It's actually the EMTALA law.
There's
What
there's where it comes down to where it's life or death. You got to pick between the woman and the child. That there's pretty much no scenarios where a woman is going to either die or she has to choose the baby. That's just stuff, that's propaganda they make up to tell you so that they can justify homicide of tiny Americans. It's nonsense. And I used to be the other way. I used to think that abortion was no big deal. Actually, I didn't want to have kids by these people. You don't trust these people. But it's deeper than that. It's actually homicide. It's not just a simple little thing you just do willy-nilly. It's not for birth control. And I've had to learn that, unfortunately.
question? When we met in my office, you said about lowering drug prices, that when Big Pharma price gouges, the American people suffer. I think we both agree on that. And I think you're sincere in your belief that you want to reduce prices for Americans, correct?
Yes.
Yeah. The Inflation Reduction Act empowered Medicare to negotiate prescription drug prices. It penalizes drug companies for price hikes above inflation, and it caps seniors' out-of-pocket drug costs, along with reducing insulin prices to $35 per month. But your future boss, Donald Trump, on his first day in office, revoked President Biden's executive order that actually directed the health secretary to examine ways to reduce drug prices and improve access to innovative therapies for the American people. And unfortunately, Republicans in Congress to repeal the Inflation Reduction Act, which means reversing all of those things that we worked on to lower prices for Americans. So my question to you is, what do you do? Why are you there? Are you there to be a rubber stamp to this administration and cave into all of these positions that they're taking, even though you know they're in disagreement with your positions on lowering drug prices and that they could harm Americans? How do you handle that as HHS director?
Senator, my understanding is that the White House issued an executive order, I believe today, supporting the drug negotiations under the IRA. President Trump was very aggressive during his first term about negotiating drug prices. He has instructed me, and I've met with him repeatedly as though we need lower prices than seniors in this country. And
so let me ask you this, because I only have so much time. So we've already negotiated lowering prices for 10 drugs with Big Pharma. Big Pharma, by the way, opposes this. They have not only are asking for a pause, they have filed lawsuits, but we've already negotiated the first 10 drugs. And we want to expand it to the next 10 to 15 that the Biden administration has put forward. Would you agree and continue that path of really mandating that Big Pharma come to the table and negotiate drug prices for Medicare so we can lower those prices for Americans?
my understanding is that the executive order that was issued today, which I haven't seen, but I've read a summary.
Well, let me ask you this then, because you keep citing the Trump administration and you're just going to follow what they say. Is that what you're doing? You're just a rubber stamp for them in this position? So anybody, so it doesn't matter that you're before us. It could be anybody coming before us as long as they're a rubber stamp for this administration and disregarding your beliefs and what you think. I guess my question to you is, if it really is fundamental to what you believe, how do you live with that? How do you address those issues and moving forward?
You want me to
Knowing
answer
that
the
it's going to harm
question?
Americans. Yeah.
You want me to answer the question?
No, I'm asking you.
Okay. President Trump has asked me to end the chronic disease epidemic and make America healthy.
Is that the only reason why you're at the HHS? Is that the only reason why then you're at the HHS, to address that one issue?
President Trump has asked me because I'm in a unique position to end that. And that is what I'm doing. And if we don't solve that problem, Senator, all of the other disputes we have about who's paying and whether it's insurance companies, whether it's providers, whether it's HMOs, whether it's patients or families, all of those are moving deck chairs around on the Titanic. Our ship is sinking. Our 60% increase in Medicaid over the past 4 years is the biggest budget line now, and it's growing faster than any other. No other nation in the world has what we have here. No other nation has a chronic disease. We have the highest chronic disease burden of any country in the world. We had, during COVID, we had 16% of the COVID deaths in a country. We only have 4.2% of the world's population. We had a higher death count than any country in the world. And when CDC was asked why, they said it's because Americans are the sickest people on earth. The average person.
How are we the sickest people on earth if we have an FDA, a CDC, and an EPA? Obviously, there's an agenda to wipe us out.
Health or sense of well-being.
Trump being elected and RFK Jr. being made the head of the HHS is going to stop the depopulation agenda against Americans.
Senator Barraza.
Thanks so much, Mr. Chairman. Mr. Kennedy, thank you for taking time to visit with me in my office prior to today's hearing to talk about a lot of the important issues affecting healthcare in my home state of Wyoming as well as the nation. I appreciate your willingness to serve.
That's Larry David's old wife from the show. That's Carol.
Financial obstacles.
Oh, she is married to RFK. Oh, I didn't know that. I forgot.
BGYN and then new regulations that are painful that have come out of the Biden administration, hurting our ability to provide nursing home staffing. So let me start, if I could, with rural hospitals and the closures of hospitals like that. There are a lot of challenges facing hospitals in rural communities and frontier areas. We have 33 hospitals in Wyoming. 26 are really located in areas, locations, often hard to get to. Weather impacts them. 6 of the hospitals are at risk of closing. 2 are at immediate risk of closing in the next 2 years. 10 have had to cut available services. And this is a concern of rural hospitals, both Republican and Democrat states, either way, bipartisan. Critical that the workforce challenges, financial challenges that we're facing are addressed. Can you commit to working with us on a plan to address the critical nationwide issue of rural health care?
Yes, yes, Senator. I would say that during my visits, I visited almost 60 senators so far. And the most common unifying, I would say, issue among both Democrats and Republicans, there were 2. One was PBM reform, and the others were all hospitals. And our nation made a commitment over 100 years ago to put up a hospital within 30 miles of every American. We generally succeeded in doing that. It's absolutely critical. It's life-saving. And rural hospitals are closing at an extraordinary rate right now. They not only provide important health care for the localities, but also they're economic drivers for localities all over this country. Well, President Trump is determined to end a bridge of rural hospitals, and he's asked me to do that through the use of AI, through telemedicine, which these are innovations that I saw the other day.
By the way, I don't trust AI when it comes to medicine, just because if it can administer medicine, it can also have you administer poison. It's in the eye, it's in the hands of the controller, and that comes with anything to do with medicine. However, I would prefer humans, an actual person, to talk to me, even though medical malpractice is the number 3 cause of death in this country and they're no more trustworthy. I just think it's just to disconnect between humans and let a computer or an AI, which is really just predictive thinking. It's not actually processing that. It's not actually intelligent. It's not thinking for itself. It's kind of a misnomer to call it an AI. I just think that it does a disservice to humanity, and I don't think it's going to work out good for us in the long run. I mean, we're not even that good at it. As of yesterday, the Chinese just crashed our AI market. So I actually predict the NVIDIA stocks are about to drop. And I was just about to get in on it too.
Hospitals and maternity services. So now we have women in Wyoming having to drive over 100 miles to access care. 13 counties in Wyoming don't have access to OB. And we're talking counties larger than the states of Vermont, New Hampshire, Rhode Island, Connecticut, New Jersey, Delaware, counties larger than those whole states. So will you commit to working with my office to find solutions to help address these specific maternal health challenges in rural America?
Yes, Senator, I look forward to it.
Another issue we specifically spoke about with this harmful Biden administration rule that have really been bad for our rural nursing homes. And it's a rule that would triple the registered nurse requirements in nursing homes. This is going to lead, there just aren't enough registered nurses in our state to be able to comply with this. This would lead to nursing home closures across our state. Will you commit to working with me to fix this serious problem as a result of a rule that came out by the Biden administration, who clearly doesn't understand rural America?
Yes, Senator, I think the rule was well-intentioned, but as you've said, and I've heard from many rural senators, it will be a disaster for their states. Some of the nursing homes, these are staffing rules that require 24-hour staffing by medical professionals. Some of the nursing homes in rural areas simply do not have the available personnel or the economics to be able to do that. It will mean the closure of nursing homes in rural areas all across our country, which means the parents, elderly parent, will be moved a great distance from the local community and their family. And we know that the single greatest driver of high quality nursing home care is the involvement, the proximity of family members. When you move that nursing facility away from the community where the kids live, you're going to get much worse care. So the intention, although it was noble, was in reality, for rural areas at least, it is going to be a disaster.
Thank you. Thank you, Mr. Chairman.
Thank you. Senator Johnson.
Mr. Kennedy, welcome. Thank you for being here.
Again, like and subscribe, and if you don't mind sharing this video so we're watching this live. If you do hear any snoring in the background, that is Mr. Bacon. I don't know why he decides to come sit next to me in my little makeshift studio and snore. I'm fostering him. Somebody passed away that was his owner, so he's just crashing with me, and he does crash. So if you hear any noise in the background, it's not construction, it's just the Baconator. So, but yeah, please like and subscribe to the page, share it. Trying to get more followers on this new page so I can build up an audience, and then things can get interesting. The Bacon.
We get to the answers of this, but even more, we need to heal and unify this divided nation. I'm not necessarily the most optimistic guy because we've got enormous challenges facing this nation, but I thought, wow, here's somebody from the left, somebody I don't agree with on many issues politically, coming together with President Trump and focusing on an area of agreement, something that the American people desperately want. Finding out the answers. What has caused autism? What is causing chronic illness? Ms. Kennedy, I think I've come to know what's in your heart. I think I know the personal and political price you've paid for this decision. I want to say publicly, I thank you for that. I truly appreciate what you're doing here. Can't we come together as a nation and do this?
No.
Can we do that? Aren't you getting tired of this? I'm getting tired of this. So again, Mr. Kennedy, I need to enter in the record. These are just 11 letters of support signed by 63,000 people, thousands of doctors. From the American Association of American Physicians and Surgeons, Independent Medical Alliance, the North Carolina Physicians and Freedom Group, Governor Jeff Landry from Louisiana. These are Americans, nonpartisan. A lot of these people I know because I've advocated with you. A lot of them are Democrats. They put their political differences aside. So, Mr. Chairman, I'd like to enter this in the record.
Without objection.
I also do want to, Mr. Kennedy, as long as I have you here, I've written over 70 oversight letters to the federal health agencies under the Biden administration. I've virtually gotten squat them. Okay, what I get is we get, for example, 50 pages of Anthony Fauci's emails redacted. Oh, by the way, the latest one was 17 pages. Instead of issuing a health alert on the myocarditis they knew was impacting young men early in 2021, instead of issuing an alert on the Health Alert Network, they developed 17 pages of talking points. This was given to the public under a FOIA request. They had to go to court. They got a new way of redacting. They don't black things out. They just give you white pages. So you don't even know what they have redacted. So again, I've issued a subpoena now to cover the information I've requested in 70 oversight letters. My question to you is, as Secretary of HHS, will you honor these requests from Congress and will you make HHS transparent?
Yeah, my approach to HHS, as I said before, Senator, is radical transparency. Democrats and Republicans ought to be able to come in and get information that was generated at taxpayer expense that is owned by the American taxpayer. They shouldn't get redacted documents. Public health agencies should be transparent. And if we want Americans to restore trust in the public health agencies, we need transparency. I want to say something about what you first said. When I launched my campaign, it was about uniting Americans, Democrats, Republicans. There's no issue that unites us more than this chronic health epidemic. There's no such thing as Republican children or Democratic children. These are our kids. 66% of them are damaged. I know what a healthy kid looks like because I had so many of them in my family. I didn't know any of the food allergy growing up, peanut allergy. Why did 5 of my kids have allergies? Why are we seeing these explosions in diabetes, rheumatoid arthritis, neurological diseases, depression, all these things that are related to toxicity and corrupt environment? Why can't we just agree with each other to put differences about so many issues, intractable issues aside, and say, we're going to end this? I don't think anybody is going to be able to do this like I am because of my peculiar experience, because I've litigated against these agencies. When you litigate against them, you get a PhD in corporate capture and how to unravel it. I've written 6 books about these agencies. I know a lot about them and I know how to fix it. And there's nobody who will fix it the way that I do because I'm not scared of vested interests. I don't care. I'm not here because I want a position or a job. I have a very good life and a happy family. This is something I don't need. I want to do this because we're going to fix it. And the other thing is we are attracting now a caliber of people to HHS like never before in history. And they're entrepreneurs, they're disruptors, they're innovators of immense talent that are walking away, many of them from growing concerns. They're not coming there for position. They're coming there because they want to save our country. Across the political spectrum. All these Democrats are opposed to me for partisan issues. They used to be my friends. They agreed with me on all the environmental issues that I've been working on for my whole career. Now they're against me because anything that President Trump does, any decision he makes, has to be lampooned, derided, discredited, marginalized, vilified.
We need to move on. Senator Warren.
Thank you, Mr. Chairman. So, Mr. Kennedy, I want to start with something that I think you and I agree on, and that is that Big Pharma has too much power in Washington. You said that President Trump asked you to, quote, clean up corruption and conflicts. Sounds great. You said that you will, quote, slam shut the revolving door between government agencies and the companies they regulate. That also sounds great. So here's an easy question. Will you commit that when you leave this job, you will not accept compensation from a drug company, a medical device company, a hospital system, or a health insurer for at least 4 years, including as a lobbyist or a board member?
Can you just repeat the last part of the question? Would we get a commit?
You're not going to take money from drug companies in any way, shape, or form.
Me?
Yes, you.
Oh, I'm going to commit to that.
Okay, good. That's what I figured. I said it's an easy question to start with. And I think you're right on this.
I don't think if you want to give me money, by the way.
Let's keep going. You're right because to say yes, because every American has the right to know that every decision you make as our #1 health officer is to help them and not to make money for yourself in the future. So I want to talk more about money. I'm looking at your paperwork right now. In the past 2 years, you've raked in $2.5 million from a law firm called Wisner Baum. You go online, you do commercials to encourage people to sign up with Wisner Baum to join lawsuits against vaccine makers. And for everyone who signs up, you personally get paid. And if they win their case, you get 10% of what they win. So if you bring in somebody who gets $10 million, you walk away with $1 million. Now, you just said that you want the American people to know you can't be bought. Your decisions won't depend on how much money you could make in the future. You won't go to work for a drug company after you leave HHS. But you and I both know there's another way to make money. So, Mr. Kennedy, will you also agree that you won't take any compensation from any lawsuits against drug companies while you are secretary and for 4 years afterwards?
Well, I'll certainly commit to that while I'm secretary. But I do want to clarify something because you're making me sound like a shill. I put together I did the Science Day presentation to the judge on that case to get it into court.
Mr. Kennedy, it's just a really simple question.
Yeah.
You've taken in $2.5 million. I want to know if you will commit right now that not only will you not go to work for drug companies, you won't go to work suing the drug companies and taking your rake out of that while you're secretary and for 4 years after. It's just
I'll commit to not taking any fees from drug companies while I'm secretary.
I'm asking about fees from suing drug companies.
You're asking me to not sue drug companies.
No,
and I'm not going to agree to that.
companies as much as you want.
I'm not going to agree to
Is she asking him to not sue any drug companies?
Let's do a quick count
Who?
here.
Now we know who's paying her.
Secretary of
Primary her. Let's find out who she is
and
and primary her.
you can
Who's speaking right now?
influence
Primary her.
of those lawsuits. Well, let me start the list. You can publish your anti-vaccine conspiracies, but this time on U.S. government letterhead, something a jury might be impressed by. You can appoint people to the CDC vaccine panel who share your anti-vax views and let them do your dirty work. You could tell the CDC vaccine panel to remove a particular vaccine from the vaccine schedule. You could remove vaccines from special compensation programs, which would open up vaxxers to mass torts. You could make more injuries eligible for compensation, even if there is no causal evidence. You could change vaccine court processes to make it easier to bring junk lawsuits. You could turn over FDA data to your friends at the law firm, and they could use it however it benefited them. You could change vaccine labeling. You could change vaccine information rules. You can change which claims are compensated in the vaccine injury compensation program. There's a lot of ways that you can influence those future lawsuits and pending lawsuits while you are secretary of HHS. And I'm asking you to commit right now that you will not take a financial stake in every one of those lawsuits, so that what you do as secretary will also benefit you financially down the line.
I'll comply with all the ethical guidelines.
That's not the question. You have said we're
asking me not to sue vaccine.
No,
Yeah, you are. That's exactly what you're doing.
Look, No one should be fooled here. For Secretary of HHS, Robert Kennedy will have the power to undercut vaccines and vaccine manufacturing across our country. And for all of his talk about follow the science and his promise that he won't interfere with those of us who want to vaccinate his kids, the bottom line is the same. Kennedy can kill off access to vaccines and make millions of dollars while he does it. Kids might die, but Robert Kennedy can keep cashing in.
Senator, I support vaccines. I support the childhood schedule. I will do that. The only thing I want is good science, and that's it.
How about this? You won't make money off what you do as Secretary of HHS.
Before we go to Senator Tillis, I think it would be important for me to make it very clear that Mr. Kennedy has gone through the same Office of Government Ethics process as every single other nominee in the Finance Committee this year and in previous administrations. In addition to listing his assets, including the items that you've identified, he has signed an ethics letter that has been reviewed by the Office of Government Ethics concerning any possible conflict in light of its functions and the nominee's proposed duties. And we have a letter from the Office of Government Ethics that he has complied completely with all applicable laws and regulations governing conflicts of interest.
Mr. Chairman, point of information here. Have we had a single nominee come through who's made $2.5 million off suing one of the entities that it would be regulating and plans to keep getting a take of every lawsuit in the future? Have we had that before?
I haven't reviewed the past documentation of every other nominee's financial interests. And so, no, but I know that every single time we get a nominee, their financial interests are attacked. That's why we have the Office of Government Ethics. That's why they've reviewed everything that's in his record. And that's why he has even, I think, and I don't know that I want to ask him to get into it, but he has listed his assets and has gone through a discussion of the responsibilities under our ethics laws and is complied with all of those requirements.
Yeah, this is just a formality. He's going to be confirmed. He's already confirmed. None of these people are strong enough to come against MAGA, against Trump, against the mandate. And whoever that was talking, we're going to find out who she is, and we're going to primary her. Well, that's crazy. Larry David's wife is sitting behind, well, his wife on the show is sitting behind Kennedy. I guess that's his new wife. This is better than TV.
Thank you. It's amazing to me that people. Well, first off, you need to understand I was in a judiciary hearing this morning. It's very clear to me that some of these nominations are going to be shirts and skins. So no matter what you answer in the affirmative, they're going to ask you one more question so that you won't be able to answer in the affirmative. That's just the way the game gets played when we have nominees like yourself. So I think you're handling yourself well. I got a real quick question for you. Are you a conspiracy theorist?
That is a pejorative, Senator, that's applied to me mainly to keep me from asking difficult questions of powerful interests. I was told that I was a conspiracy theorist. That label was applied to me because I said that the vaccines, the COVID vaccine, didn't prevent transmission and wouldn't prevent infection, when the government was telling people, Americans, that it would. I was saying that because I was looking at the monkey studies in May of 2020. I was called a conspiracy. Now everybody admits it. I was called a conspiracy theorist because I said red dye caused cancer. And now FDA has acknowledged that and banned it. I was called a conspiracy theorist because I said fluoride lowered IQ. Last week, JAMA published a meta-review of 87 studies saying that there's a direct inverse correlation between IQ loss.
So is there any one of them that you can say, you got me? That really was a conspiracy theory, or are you in a position to submit for the record? I think it'd just be helpful for every one of these narratives for you to submit that maybe for the record.
You said something about SNAP lunch. I was in the state house in North Carolina before I came here, and anytime I'd go visit an elementary school, the first thing I would do is go to the trash cans in the cafeteria. And what we have now are kids that are not eating food because the dictates of the federal government have made it something that they don't want. But they say, well, it's a healthy alternative. It has processed materials in it, and it's not particularly attractive to them. So they throw it away. Trash cans full of food that these kids didn't eat. So then what do? They go eat snacks, or they go eat or they drink a sugar drink. The SNAP program, everything you said about the SNAP program, I agree with. I think that we should be very, very strict about that. And it's going to make some people uncomfortable in the food manufacturing segment, produce healthy program. That's the way to address it. But we also need to look at the school health program. I was PTA president 22 years ago at my daughter's high school.
Let me give you guys an example of why I'm so upset. This is the last guy that they put in this position 4 years ago. Where is he? Or you know what? It's actually, I'm going to Instagram. You know, let me just.
Is by extension saying that they're happy with the outcomes. I think it's unacceptable. I do have a question for you on Project Warp Speed. We supported the CARES Act with 97 people in the U.S. Senate vote for it. Everybody here, there's only one member of Congress that voted against it, I believe. And Project Warp Speed had CDC, FDA, NIH, and BARDA very much in the mix. Now, some people think that you're going to come in here and insert yourself into those agencies in a way that's never been done before. Let's say that they're part of a future Project Warp Speed. Is it your intent to go in and do something that's never been done before, based on my staff's research, and insert yourself in a discussion that the scientists are dealing with those different agencies?
No, Senator, what I want to do is, I'm not a scientist. I want to empower scientists. I want to make sure that science is unobstructed by vested or economic interest.
That's good.
Culture, I'll just say about Operational Warp Speed. It was an extraordinary accomplishment, demonstration of leadership by President Trump.
Warp Speed never happened. They played Trump when it came to that. The things they say came from Warp Speed already existed. For one thing, Warp Speed wouldn't have been able to generate that many in such a short period of time. Remember, this is 9 months later. It would have took years to make that many and package them up and get them shipped. It's impossible. And I don't know if Kennedy knows that. I don't think anyone's done the math with him, but someone should tell them. But they just have so much going on in front of them, they're not able to think and question everything else around them. That's the unfortunate part of being in the spotlight. Too many blind spots.
It became very narrowly focused. We ended up with the worst, the highest death count of any country in the world.
Mr. Chair, if I can just ask one final question, and I think it's a one-word answer. I've heard a lot of people complaining about healthcare delivery.
And this is why I don't like these people that are talking to him right now. This is why I don't respect them. This is the last person who they voted for 4 years ago. A mentally ill man dressed as a woman who's also pretending to be a 3-star general, all based on what they do disgustingly sexually at night and their mental disability, their mental illness. This is the head of HHS from 4 years ago that just lost their job. This is who it was. So those same people asking Kennedy all these questions, where were you when they slid this God forbidden thing through? Where were you? I can't take any of them seriously.
We have 85 million people who are
especially not him. He's a sellout.
All kinds of chronic illnesses. Our life expectancy is lower than other countries. And for working class people in this country, they are living 6-7 years shorter lives than the top 1%. We got a problem. Okay? And I'm going to suggest some ideas that I think can remedy that. Last year, the insurance industry.
Somebody in the comments called him Larry David. That's
While
funny.
at the same time, 85 million Americans are uninsured or underinsured. Do you agree with me that the United States should join every other major country on earth and guarantee health care to all people as a human right? Yes? No?
No.
Senator, I can't give you a yes or no quick answer to that question.
Healthcare a human right?
No.
Is healthcare a human right?
Hell no. No, it's not.
In the way that free speech is a human right, I would say it's different because if with free speech doesn't cost anybody anything, but in healthcare, if you or smoke cigarettes for 20 years, you get cancer, you are now taking from the pool. And so are you guaranteed the same right?
I'm sorry. I'd love to talk for an hour with you. We got a few minutes left here. All right.
The reason I say F no, hell no, is because of people like this right here. This thing that we're going to actually go live and talk about, this thing is suing Lyft because the driver looked at her massive size and said, I cannot fit you in my Toyota Corolla. Look what she's done to herself, to her body. And she doesn't have a care in the world. You know, it's weird. How are the poorest people in the country obese? Maybe they're not poor. Maybe all these special government services are enabling these people to do this to themselves. And now she wants to sue Lyft because this man did not want to damage his property. And they didn't take her money, made sure she got her money back, and nobody charged her. I'm supposed to pay for health care for life for somebody who does this to themselves on purpose? Hell no.
I think in principle we should end that disparity.
Okay, that's great. All right. I happen to believe that climate change is real, it's an existential threat, and it is a healthcare issue.
It's not. There's no such thing as climate change. The climate is not changing, and it's not a major healthcare issue. That's all fake nonsense.
Or is it real, causing devastating problems?
President Trump and I, from the beginning, from our first meeting, agreed to disagree on that issue. I believe climate change is existential. My job is to make Americans healthy again.
Right.
You believe that you disagree with Trump? You don't think?
Stop cutting him off, you old Larry David.
I just asked you that. It's okay. Not a trick question.
I answered your question, Senator.
Okay.
Yeah, don't get smart with him. He'll whoop your ass. He's about your age,
Okay.
but he works out every day. Don't get spanked.
Look, there is no question that abortion is a divisive issue in this country. I would say a majority of the people are pro-choice. There's a strong minority who are pro-life. A year and a half ago, you went to New Hampshire, running for president, gave a speech, and you talked about government should not tell a woman what she can do with her own body. That's her choice. Now, I think everybody on that side is pro-life. I think everybody here is pro-choice. I have never seen any major politician flip on that issue quite as quickly as you did when Trump asked you to become HHS secretary.
I wish Kennedy could just fire on some of these people with their lies and their nonsense. And Bernie's such a sellout. Remember all the Bernie people? He had all that momentum, and then he capitulated and got on and bent the knee for Hillary Clinton just for them all to lose to Trump. That's what you get when you're a grifter. And he's talking about all the millionaires and the billionaires, and then they paid him off, made him a millionaire. He no longer talks about millionaires. He only talks about billionaires, if he talks about money at all anymore. But he's a socialist. Well, he's a fake socialist. If he was a real socialist, he would have relocated to a socialist country. People go to what they believe in. People migrate to greener pastures, and they find people of like kind. No one's going to just force themselves to stay somewhere they're not happy. It's all just a grift.
Babies. One of them is titled Unfaxed, Unafraid. Next one, and they're sold for $26 a piece, by the way. Next one is No Vax, No problem. Now you're coming before this committee and you say you're pro-vaccine. Just want to ask some questions. And yet your organization is making money selling a child's product for $26, which casts fundamental doubt on the usefulness of vaccines. Can you tell us now that you will, now that you are pro-vaccine, that you're going to have your organization take these products off the market?
Senator, I have no power over that organization. I'm not part of it. I resigned from the board.
That was just a few months ago. You founded that. You certainly have power. You can make that. Are you supportive of this?
I've had nothing to do with
Are you supportive of these onesies?
I'm supportive of vaccines.
Are you supportive of this clothing, which is militantly anti-vaccine?
I am supportive of vaccines. I want good science and protect you.
I am not. And as far as I can tell, it's junk science. But everyone just has to say, it's like they want you to say it. They want you to say it. Just like when it was the whole Israel thing. Do you denounce what they're doing? Do you? It's like, why do I have to repeat after you? Let me just say what I want to say. This whole pro-injection thing is insanity. And everyone knows that he knows it. And that's why once he gets in here, that stuff is all over.
Shouldn't have time to cover them all when we met prior to the meeting, but rural health care is very important to me and the people of Tennessee. 78 of our 95 counties are rural counties. Now,
oh, really? I didn't know that.
Years we've seen hospital closures. So we have focused on access in rural areas, and my rural health agenda, which is bipartisan, focuses on innovation, telehealth, access points. It focuses on work shortages, and also Senator Warner have to get.
By the way, this is Robert F. Kennedy Jr.'s confirmation hearing. He is confirmed, but this is just the part of the process where it's a humiliation ritual bukkake type thing where they all just kind of surround him and he stands there in the middle. He's like, and that's all it is. They did it to Pete Hegseth. They did it to everyone, but I don't remember them grilling that man that's mentally ill dressed as a woman when he became the head of HHS 4 years ago. Maybe we'll go back and look at that together because this is YouTube, is on historical record, but I don't remember them grilling him like that. I don't. The way they're cutting off RFK and asking him all these crazy questions. It's just all political theater. They're not asking him because they want him to respond. They're just doing it for sound bites and to pretend like they're doing their job when they're inept and they're lazy and they're really just a leech on the American tax base. They're just leeches. They serve no real purpose. They don't protect us from anything. Like they said, the sickest country in the world, and we have all these agencies and all the people supposed to look out for us. Apparently not. Apparently somebody's being paid not to. The food in Colombia and the food in America are completely different. The food here is illegal to sell there. What does that tell you about who's approving and what our agencies that are supposed to protect us? Let's see how efficient they are. Obviously, they're not. They're not safe and effective. I mean, it's the namesake of the page, right?
Our children. And $90 million, to me, that is heartbreaking what is happening there. So how will you prioritize oversight of prescribing practices while promoting alternative solutions such as counseling, behavioral therapies, community-based interventions for our youth?
Exactly. That's the solution. 15% of American youth are now on Adderall or some other ADHD medication. Even higher percentages are on SSRIs and benzos. We are not just over-medicating our children, we're over-medicating our entire population. Half the pharmaceutical.
You know what? You know what's funny about that statistic? The kids who are getting medicine and on those prescriptions, they're also given a check as well. So it's kind of like their parents are pretending that they have these mental issues, and if they take the medication, they also are financially compensated as well. So it's like you're being paid to take the drugs that they're being paid to sell to you. That's corruption at its finest.
Initiatives, we need access to treatment, we need exercise, we need better food.
Okay, let me talk to you about one of those access points in treatment. And this highlights.
And look how good he looks. He's like the oldest guy there. Literally trains, works out, and could whoop anybody in there probably. And he's like in his late 70s. I'm probably he's like around Trump's age. He's barely any younger than Trump. Barely.
Facilities with more than 16 beds. This is a discriminatory exclusion, and it denies payment for medically necessary care based on the illness that is being treated, and it has perpetuated unequal coverage in mental health care. So if you're confirmed, when you're confirmed, will you commit to working with me on repealing this discriminatory exclusion and ensuring equal access to mental health care for Medicaid beneficiaries?
Yes, Senator.
Thank you so much. I've got a question on PBM reform, one on artificial intelligence in healthcare. In the interest of time, I will yield back. I look forward to seeing you help make us healthy again.
Thank you, Senator.
Make America healthy again. Maha. Beautiful.
Senator Lujan.
My co-host that's going to be on the show with me later on this evening, Rocky, he's not necessarily a big fan of MAGA or MAHA, but you know, he's a good friend of mine, but he's not a fan of the movement. He sees a lot of issues in Trump, but you know, some of us look at the glass as half full, some look at it as half empty. No one's going to be perfect. I don't see the purpose of criticizing too much when there's been so many net positives. I think it will just be ungrateful. There's been so much good that's happened in just this short week. So I don't know, but we'll be on here talking about that later on tonight. Rocky, he'll be on with me, and I'm sure people are going to have questions for him, and we'll try to talk about, you know, the latest news, and we will address questions in the audience as well.
Nearly 11,000 people in the state of Washington, over $1.2 billion worth of grants. So while I agree with you on healthy foods, I definitely am troubled by the medical research side of innovation and some of the things that you have said. In fact, this issue about laying off 600 employees at NIH, or giving the fact that, to quote, give infectious disease a break for 8 years. So we've had a chance to talk about this a little bit, but the most striking example of this is when COVID hit, and we were the first in the nation. We had the first case, and it really...
I don't know about you guys, but I don't ever remember it hitting. I lived in downtown LA, right next to Skid Row. All the homeless people were still there 2 weeks after. They were wondering why we weren't outside, but they couldn't shelter in place. They couldn't lock down, and they're all still there. It should have looked like somebody put a Raid can outside and all the roaches were just laying around, you know, when you bomb an apartment or something, but it wasn't. So when did it hit? Or when did the World Economic Forum hit our media apparatus? You know, remember Project 201? Let's see, what was it called? Project 201. No, it was called Project 201 simulation. Event 201, not Project. Event 201. That's when they organized what they were going to do a few short months before. I don't remember anything hidden, by the way.
Nothing is studied at NIH about the etiology of our chronic disease epidemic.
But right now,
money is going to infectious disease. And
I get your point. It's an interesting point. The problem is we had to respond, and it's actually...
I wish they would pan over so we could see these idiots that are talking.
What was wrong, and that we had an outbreak of COVID that was going beyond the very first case.
What
So we
outbreak?
had to build a very fast response.
What outbreak skips
So
homeless
I think
people?
this too. The University of Washington has conducted groundbreaking stem cell research on
The most
fetal
vulnerable,
tissue.
the ones that
To
live
me, I know
outside,
there's probably a lot of people that may not agree with this.
no
But we're
masks.
making regenerative heart tissue now at the University of Washington. So yes or no, do you commit to protecting stem cell research for scientific agencies if confirmed?
I will protect stem cell research. Stem cell research today can be done on umbilical cords, and you don't need fetal tissue.
You'll protect the laws that are on the books today and the research that's done.
My job is, Senator, to enforce the laws.
Okay, so I want to move to PBMs because PBMs are driving up drug prices. And one of the biggest things that we need to do here, I think, in a new administration is get a handle on everything that is driving up prices and lower them. The report found that PBMs generated $1.4 billion from spread pricing. That is where they are able to basically set the price, not reimburse pharmacies, and then pocket the rest. We've had bipartisan legislation in several different committees now to get at this. What do you think the solution is?
Oh, I think one of the really notable achievements of this panel was the PBM legislation that they put together in a bipartisan way. I haven't met a single senator, well, actually one only, but the 60 odd senators that I talked to, all of them talked about PBMs and how important it was, and work. President Trump, during his first administration, pushed through a law or pushed a law to give transparency to PBMs. It got overruled during the Biden administration. Luckily, this panel is resuscitating that. President Trump is absolutely committed to fixing the PBMs.
My time is running out, so I just want to clarify. You believe that we should pass these laws that now have been proposed in the Senate?
I haven't read the entire law, so I don't know, but I think that we need to reform the PBMs. I think we need to get rid of all of these vested interests that are draining money from the system.
Okay, somebody suggested though that you thought you should convene the PBMs and talk to them about some sort of self-regulation. So I am trying to distinguish between these people who basically are doing illegal activities and ripping off, really they're creating pharmacy deserts in my state. So I'm asking you whether you believe that we have to legislate in this area.
Again, I'm not being evasive. I just don't know exactly what the law says. I met with the PBMs. I met with pharma. My job is to meet with all the stakeholders. I've been meeting with stakeholders for 40 years. People I was suing, you want to hear from the other side. Well, it doesn't mean I would let the PBMs write their own ticket.
I think
I support the efforts of this committee to come up with bipartisan legislation. President Trump wants to get the excess profits away from the PBMs and send it back to primary care, to patients in this country, to high quality.
I'll ask you for the record, since my time's expired, to look at the legislation that came out of the Commerce Committee that defines the legal activities that they are doing to drive up prices. Thank you for the answer for the record. Thank you, Mr. Chairman.
In principle, I support that legislation.
Thank you. And let me just tell you the list as we have to move forward to the ending here. Senator Lujan will be next, followed by Senator Marshall, Senator Warnock, Senator Smith, Senator Young, and Senator Welch.
And
God damn, that many more people?
Mr. Chairman, this is a matter of such importance.
That many more people? Did this thing have to go through this much criticism?
It would be important to offer, say, a modest amount of additional time to get in.
Look, he's going to be confirmed. I'm actually going to set up, we're going to do another video in about 30 minutes. Do me a favor, like and subscribe to the YouTube page, Safe and Effective Pod. You have to just type it in. I don't know why it doesn't really come up on YouTube easily. So Safe and Effective Pod. And that way you can be there when we go live in a couple of hours. And we'll be on Rumble, X. Hopefully they didn't flag this video because of what we talked about earlier when it came to the injections. But I'll be back shortly. Thank you for watching these last hour and a half. But this is a great day for the MAGA and MAGA movement and for transparency so people can find out what did they put into their arms, and we won't get censored for talking about it now because this is our, our government officials, and they're not going to be able to go against them. So that's great, for transparency and for the future. And so we can figure out what actually happened. I know what happened, and I've been telling people what's going on for the last 3 years, but now these people are going to tell you, the officials. And then you can see that I was ahead of the curve. So I'll be back on shortly. Like and subscribe to the YouTube page if you don't mind, and then on the Instagram as well if you're watching on Instagram. And then we'll be back on with my co-host, and we'll go over this topic and some more news. Thank you. Talk to you shortly. And there's a little outro from our sponsor, cosigning.com. If you're looking to move to an apartment, but you don't have a friend or a family member willing to co-sign for you, our friends at cosigning.com will assign you a co-signer who will help you get approved today. So thank you very much, and we'll be back shortly.
I've been needing to find a new apartment, which has not been easy with credit as bad as mine. Luckily, I found cosigning.com. They connected me with a cosigner who helped me get my dream apartment for me and my dog. I just paid a small fee and was able to move in fast. Get the cosigner you need for the apartment you want. Check out cosigning.com today.